The Victor Black Masterclass presentation is brought to you by www.muscleandiron.com.
Sawadee Kap, hello and welcome to another Victor Black Masterclass video. In today's video, we are going to be looking at the compound recombinant human growth hormone and the consequence of the use of that compound in a side effect, carpal tunnel syndrome. I'm going to be talking principally about the underlying cause of this side effect and asking the rather obvious question for those people that do suffer from this side effect, because it doesn't affect everyone in the same way. Is there anything that we can do to provide a little relief to sufferers? So let's get started with today's video. In the video, I'm going to basically be addressing the following points. I'll just talk very briefly about what carpal tunnel syndrome is, and I want to talk about its relationship with growth hormone. Just very quickly, the concept of carpal tunnel syndrome, in acromegalics, and that's people that basically naturally overproduce growth hormone, principally as a result of a tumor in the pituitary gland. I'll explain that a little further. It's carpal tunnel syndrome in relationship to those undertaking recombinant human growth hormone therapy for those that have a growth hormone deficiency, and carpal tunnel syndrome for those that are using recombinant human growth hormone performance enhancement. I'm just going to touch very briefly on those things, and then I'm really going to get on to what the body of the content of this video is intended to address, which is, so why does this happen? And asking, as I said, the obvious question, is there anything we can do here to minimize its impact from those people that suffer from this side effect? And then finally, I'll wrap up the video with a suggestion, a couple of ideas for people that suffer from this that you might like to consider implementing. Okay, so firstly, let's just briefly understand that carpal tunnel syndrome is a condition where basically the median nerve, which is one of the primary nerves of the hand, gets compressed at the level of the wrist. And I'll show you a graphical representation of that in just a moment, so you'll better be able to picture what that looks like. Interestingly, most people today would associate carpal tunnel syndrome with repetitive tasks like typing. There's certain groups or individuals in our community, people like architects, I'm actually an architect by trade, they basically suffer from this disease more profoundly than many others, and this is a consequence of the repetitive use of these types of actions, and I'll explain that to you in just a moment. But interestingly, this is the point I want you to take away from this slide, carpal tunnel syndrome was actually first identified in about 1913 in relationship to its occurrence with acromegalics, and that's, as I said, the people who basically produce excessive growth hormone. That's how it was first identified. That's its first clinical description in relationship to growth hormone excess. Okay. So it's actually since been realized that about 30% to 40% of people who suffer from acromegalia actually have an issue with carpal tunnel syndrome. It's a very common occurrence in people that overproduce growth hormone as a consequence of that medical condition. So it's not a surprise. It's not a, are we certain about this? Are we sure about this? As I said, you have to understand that, that carpal tunnel syndrome, its original description in the medical literature is actually connected to excessive growth hormone. So this is not an if, but, or maybe. This is basically how it is. Now, this graphic I find very interesting. So what we're looking at in image B is basically what the actual carpal tunnel looks like. It literally looks like a tunnel through which a number of basically nerves and a number of basically tendons basically pass. They pass through this anatomical tunnel. And that tunnel is basically determined by a number of factors. Yes, there is absolutely a genetic component to this. There are certain individuals that are more or less genetically likely to be affected by carpal tunnel syndrome. And then layered on top of that, there are certain conditions that tend to exacerbate the likelihood of someone suffering from this. So firstly, we have the genetic predisposition to this condition, and then we have the behaviors and lifestyle, as it were, of those individuals that can potentially exacerbate that situation. And then we have conditions like we're going to be talking about today, where we are artificially escalating certain hormones that have the potential to, again, exacerbate this condition in certain individuals who are genetically predisposed to it. I found this graphic very interesting because you can literally see why they call it a carpal tunnel. It looks like a tunnel. And as I said, the pain that is experienced is where the basically flexor tendons pass through this tunnel and where the nerve passes through the tunnel. In the circumstances that there is compression on that nerve, this is where the pain originates from. Okay, so third slide here. I just want to briefly, recap this concept. So, carpal tunnel syndrome is very commonly presented in people who suffer from the excess production of growth hormone from a medical condition people would basically call acromegalics. About 30+% of people who suffer from this condition and who are continually exposed to excessive growth hormone over a multi-year time frame experience this condition. Okay, it's also documented in the clinical evidence that some individuals who are given recombinant human growth hormone therapy for growth hormone deficiency, and this is really, generally you're talking about adult onset growth hormone deficiency. We're talking about older people here. Some percentage of people suffer this outcome as well. Most of the people that seem to suffer this outcome, interestingly, are the people who respond best to the dosages they're given. In other words, those individuals that showed the highest IGF-1 levels from a dose response perspective also correlated to the highest percentage of people suffering from carpal tunnel syndrome. And yes, there are absolutely case studies in the medical literature for individuals that are using growth hormone in a performance enhancement context that have presented with this condition. So the takeaway up to this point is sometimes you'll hear people, debating, is this carpal tunnel syndrome? A lot of people will often use terms like carpal tunnel like, symptoms. It's actually carpal tunnel syndrome. It's not like, that's what's going on here. So it's not if, but, or maybe. That's what we're dealing with here, guys, okay? So, moving on. Let me get my next slide up. I want to, excuse me, I want to talk about why growth hormone causes this issue. There's obviously something going on that in some individuals causes us to see escalation of these symptoms. And really, this comes down to really three things. People that suffer from carpal tunnel syndrome are basically experience medium nerve compression from three consequences, three causes. One is ligament growth, two is tendon growth, and the third one is synovial edema. So in other words, you have this physically confined tunnel, basically, in which you have a number of nerves and a number of tendons that pass through. And obviously there's a synovial fluid in the context of that joint. And whenever you find a circumstance where you have hypertrophy of the tendons or the ligaments, or potentially edema of the synovial fluid, you have the potential to place pressure on that median nerve. That's the underlying cause of it. Now, in the case of recombinant human growth hormone, although it is certainly possible that there is a degree of hypertrophy to the tendons and ligaments, particularly at very high doses, yes, most people that suffer this condition, when they stop using the growth hormone, they tend to find that these conditions subside. And that would lead us to suggest that it's actually synovial fluid edema that causes this condition for our tribe, okay? So we know that total body water content increases with those people that use GH therapy. So in other words, the water you retain in your body when you use growth hormone is disproportional to normal levels of water. You retain water using this compound, and that's really the most likely underlying cause behind this synovial fluid edema. And as I said, we can suggest that in our tribe, principally based on the fact that when you kind of stop using this compound, really within 2 to 3 weeks, most people see a degree of relief from those symptoms. Okay, that's the underlying cause. The obvious question then is there anything that we can do to minimize its impact? Now, if you were to speak to someone who was a medical professional in this business, they would basically give you the following answer: reduce the dose. That's the answer. When we talk about the relief of carpal tunnel syndrome symptoms in people who suffer acromegalia, that's what they do. They lower the growth hormone levels and they realize a degree of relief. Now, obviously, and that's also true, by the way, of individuals that are using growth hormone for growth hormone deficiency. They tend to say, okay, so you respond very well to this compound. You have you have a position of being a, let's call you a hyper responder at very low doses. We'll titrate the dose down a little bit, and that's typically how it's managed. Clearly, in our tribe, most people don't want to hear that. They don't want to hear use less compounds, even though that makes rational sense, even though that is an obvious thing to say. If you're experiencing this thing, try lowering the dose. Hello, Captain Obvious. It's also fair to say, look, some individuals are going to want to push on anyway into what are considered to be super physiological levels and are looking for a solution that potentially can provide some relief, okay, whilst allowing them to retain those super physiological levels of the compound. Now, so what can those individuals do? My presentation here is premised on the fact that carpal tunnel syndrome is a condition that basically results, as I said, in compression of the nerve, but the compression of the median nerve actually has the potential also to cause biochemical changes that then in turn contribute to further damage and further issues. And in human beings that basically suffer from carpal tunnel syndrome actually show to have high levels of oxidative stress, both in the hand tendons and systemically throughout the whole body. Okay, so what we could sort of suggest from that observation is that if we can potentially lower that oxidative stress, okay, manage that oxidative stress, then potentially there's an opportunity for us to provide some relief to those symptoms through the sensible use of antioxidants here. And I'm going to be talking a lot about the use of antioxidants in the coming year. So the obvious question from that then leads to, okay, so if that's true, what would be the best antioxidant candidate here? Now, I'm going to talk in this video about ALA. Why am I going to talk about ALA? Well, principally because there are some human trials where the use of ALA in combination with other compounds is shown to provide benefit in terms of mitigation of side effects of carpal tunnel syndrome. Okay. Now, in most of the studies that have been done, it's a little bit confusing, a little difficult to understand because ALA has been used in combination with other compounds. So whenever you have multiple variables, it's always difficult to say, look, what's doing what here? However, in 2018, a study was published that basically looked at only using ALA in a monotherapy setting. And that basically is this study here. So it's the effect of ALA in a clinical setting on carpal tunnel syndrome. And in this study, basically what they did was they gave a very small number. Unfortunately, the weakness of this study is that it's in a small number of people, but this is, what we deal with basically in our space. Nothing is ideal in our world. A small number of people, this is about 20 people, 600 milligrams of ALA a day prior to a meal, and they looked at the relief both pre-surgery and post-surgery. Okay, so basically they had individuals diagnosed with carpal tunnel syndrome. They basically gave some of the individuals a placebo. They gave some of the individuals 600 milligrams of ALA by itself as a monotherapy in this context, and they looked at the relief that was basically seen in those individuals both prior to surgery and post-surgery. So I want to have a quick look at the graphical representation of those outcomes. So this is a little bit more difficult. I'm going to show you this graphically in a minute, but this is basically the actual statistics. So what we're looking at here in this table basically shows the baseline and before surgery changes between evaluation of markers that we would associate with carpal tunnel syndrome. Okay, so there is a feedback questionnaire referred to as the Boston questionnaire that are given to individuals, and then there are a number of clinical tests that basically are able to be performed on people that suffer from this condition. And you can see pretty much across the board, people given ALA at 600 milligrams a day saw some relief. Now, that didn't mean they didn't then go on to have surgery, okay? What it meant was they saw some relief. And so the logic here, the rationale here is that if you are using this compound and you are basically experiencing some discomfort, then potentially and plausibly using some antioxidants in this context can help mitigate those side effects, okay? It doesn't mean for people who suffer from, a very acute carpal tunnel syndrome that ALA is a cure-all. It's not proposed to be that. It provides some measure of relief. And in our trial, for people who tend to suffer like just that, that mild carpal tunnel-like syndrome that they talk about, and this is why they think that people talk about it as like, because it's not necessarily debilitating to the point whereby you feel like you have to go and have surgery to basically provide relief, but it's it's uncomfortable. Those individuals may well find that they get benefit from the use of antioxidants in this setting. This is the questionnaire. So this is literally feedback from these individuals, and you can see here that at a base level, the two groups had very similar levels, very similar feedbacks. The units here and the questions are somewhat new. It's just important to understand that when individuals were given ALA, there was a difference in feedback from the people given the supplement versus those people given a placebo, okay, which is a positive thing for ourselves. And then further to that, the third column shows following surgery, those individuals that also continued to use ALA after surgery saw improvement over and above the surgery people that use placebo as well. So hopefully I haven't confused everyone too much with that. So what I wanted to basically just do really quickly was just explain this, and I'm going to make some content on each of the antioxidants that I think you should make yourself aware of. Part of the challenge, quite bluntly, with antioxidants is, I tend to be very transparent. There are many things that if everything was free in this world, I might potentially take a little bit more of. I'm certainly a huge advocate of the use of antioxidants, both through nutritional programming, and ALA is a product that you can absolutely secure some percentage of intake from food through various organ meats. Now, I'm not a big organ meat guy. It's not really to my taste, but I certainly eat things like spinach and broccoli and tomatoes, which are good sources of ALA. But in this circumstance, obviously these individuals were, using a supplement, and to get to those levels, sometimes supplementation is required, right? So I will be talking about the individual antioxidants as we move forward. As I said, in this particular case, this study was done on this antioxidant, ALA, as a monotherapy, and it seemed to provide some relief to those people suffering from carpal tunnel syndrome. So what would I say is a practical takeaway here in terms of actionable items? Let's break it down really simply. Firstly, you should understand that there is absolutely, like pretty much everything in our world, a genetic component here, okay? The architecture of your wrist, and as a consequence of that architecture, the architecture of your carpal tunnel, okay, is going to determine whether you are more or less likely to suffer from the side effects of carpal tunnel syndrome. And that is true whether or not you use performance enhancing compounds like recombinant human growth hormone. This is true for natural individuals, okay? And then secondarily to that, you have to understand that the most likely underlying cause of this discomfort is what we call synovial edema, which is basically a consequence of the use of those compounds that can be modulated through dosage. Okay, so dosage is your friend here. If you suffer discomfort rather, you can always lower the dose. All right, and this is why I always recommend to guys that you start off at the minimal therapeutic dose possible, okay, and slowly, gradually titrate your dose up over time as a discovery process, as you learning about how your body responds to these compounds. And you'll notice as you move through 1 IU, 2 IU, 3 IU, 4 IU, as you go up the dosage levels, you will notice that you start to see certain side effects. Okay, there is absolutely a dosage response in terms of performance outcomes and in terms of consequence of use side effects. Okay, so by approaching it that way, if you start to get to a point where you go, you know what, at 5 or 6 IU, I'm starting to feel discomfort here, the method then of providing relief is hopefully very obvious, and that is you go back to the level where you saw therapeutic benefit, but you were not experiencing discomfort. Okay, as I said, if that's a very low level, okay, then potentially as a second pass, you would basically have a review of your position on antioxidants. Hopefully you will be doing that anyway. I encourage everyone to do that, whether they are or are not using recombinant growth hormone. And in my experience, individuals that follow both of those steps, okay, understand that like all of these compounds, there is a dose-dependent consequence to use in terms of performance outcomes and in terms of side effects. So we can control the side effects by using less of the drugs. We can control the performance outcomes by using more of these drugs. And you will, as a genetically unique individual, have a tolerance that is all your own. Okay, it is genetically unique to you. Okay, typically, as I said, guys who use relatively moderate amounts of these types of compounds, and guys that have very good dietary practice, and guys that understand the importance of oxidative stress management and manage that stress through the use of antioxidants, tend to experience less side effects across the board, and this is no exception here. All right, I myself historically have experienced discomfort in this regard, and I know that when I lower the dose just a little bit, and I make sure that my diet is fabulous, and I make sure that I'm paying due diligence to supplementation requirements, particularly with antioxidants, I can tolerate a greater dosage than I can when I'm not paying attention to these things. So that's it for today's video. As always, if you have any questions, feel free to ask. If you're not yet a subscriber to my YouTube channel, please click on subscribe, and I look forward to seeing you at the next Victor Black Masterclass. Sawadee ka.
The Victor Black Masterclass presentation is brought to you by www.muscleandiron.com.